Today, we are going to learn about National Strategic Plan for TB Elimination. So, the National Strategic Plan for TB Elimination is built on the success of the last National Health Policy and National Strategic Plan, and also on the based on the WHO SDG goals. Now, let's just get a brief introduction. What is the vision? Vision is a TB free India with zero deaths, disease, poverty, and poverty due to TB. So, zero deaths, disease, poverty. That's the vision. And what is the goal? Goal is to achieve rapid decline in burden of TB, morbidity, and mortality while working towards yes elimination of TB by 2025. This is the main thing. It aims to eliminate TB by 2025, that is 5 years before the global SDG target. The global SDG targets have been taken as such into the program. So the targets of the program are being mentioned here, like 80% reduction in TB incidence. The baseline is taken. This is the baseline data, and this is the 2015 data, and this baseline data is taken, and you have to ready our target is same as the SDG target to reduce 80 percentage of TB incidence, so that it will become 43 per lakh, and 90 percentage reduction in TB mortality, so that it would become from 32 to 3 per lakh, and 0 percentage of patients have catastrophic expenditure due to TB. So these three targets are important: 80% reduction in the TB incidence, 90% reduction in the TB mortality, and 0% of catastrophic expenditure due to TB. Now, the NSP adopts a DTPB approach, that is detect, treat, prevent, and build, DTPB approach. So the D, T, P, and B, and this can be used for talking about the objectives also, right? Talking about the objectives also. So these four are the objectives. So the first D, the four pillars of this are DTPB. So we can relate it to the objective also. Find These are the four objectives. Find all the drug sensitive TB and drug resistant TB cases with focus on TB patient seeking care from private providers. So one of the key areas that the NSP 17 to 25 focuses on is the private sector engagement. So we have to find all the DRTB and DSTB with the focus on private providers also. In the last class, I think 70% of the people are providing or taking care from private. So there are standards of TB care has been established, and so the private sector engagement is very important strategy here also. And second one, treat. So initiate and sustain all patients on appropriate anti-TB treatment wherever they seek care with patient-friendly system and social support. So appropriate anti-TB treatment should be given to all the patients. So it should be initiated as well as sustained. Okay, just initiation won't do the thing. You have to sustain the patient through the full course. Next is prevent. Prevent the emergence of TB in susceptible population. So uh, susceptible population, vulnerable population, key population, in all these people, right? Active case finding should be done, and uh, prevent the emergence of TB also. Now, build. What is the built the pillar? Strengthen enabling policies, empowered institution, and human resources with enhanced capacities. So you have to build and strengthen enabling policies, that is good policies, empowered institution, additional human resources, and enhanced capabilities. So the adequate financial resources and the policies should be undertaken for the elimination of TB by 2025. So that is the D TPB approach. And what are the key strategies? I said private sector engagement is very important, active case finding is very important, DRTB management, drug resistant TB. Addressing social determinants include nutrients, nutrition, there is Dikshay, Poshan Yojana and all. So, a robust surveillance system, community engagement, and multi-sectoral approach. So, a surveillance system should be there, community engagement, and different sectors. So, multi-sectoral approach uh, is done. So, under NSP, there are some priority areas that have been defined. In that also, there is private sector engagement, and active case finding among the vulnerable population and the socially vulnerable and the clinically high risk population. So, active case finding among the key vulnerable population. So, these are the priority intervention, private sector engagement, active case finding among the vulnerable population, and ensuring an efficient TB care. So, TB care, efficient TB care, and the fourth one is prevent the latent TB infection progressing into the active TB cases in high risk group. So, private sector engagement, active case finding in vulnerable population, TB care, and preventing the latent TB infection progressing into the active TB in high risk group. So, these are the priority intervention, and this national strategic policy is being funded by many global agencies like the World Bank, and there is USAID, that is United States Agency for International Development, and many global agencies are funding, and the government of India is also giving 100% grant in aid to the implementing agency, and state government is responsible for use the to use the existing infrastructure and provide the manpower. So they are supposed to use all these funds in an adequate way.